You're listening to Health Professional Radio with Wayne Buckler, and if you've just joined us, we're just about to have a chat with Cathy Wells. Cathy's the Policy Manager with the Breast Cancer Network of Australia, and we're about to ask her what the Breast Cancer Network does and what a Policy Manager does. So hello Cathy and welcome to Health Professional Radio.
Thanks Wayne, it's good to be with you.
Now tell us a little about the Breast Cancer Network of Australia. For those of us who don't know what it is, what's your geographic footprint and what is it that you exist to do?
So Breast Cancer Network Australia is a national organisation. We're the peak national consumer organisation for Australians affected by breast cancer. We have more than 100,000 women and their supporters connected with us from across Australia, and more than 300 breast cancer support groups that are affiliated with us. So we support all of those people.
I see. And what footprint do you cover, Australia-wide?
Yes, we're Australia-wide. So we're based in Melbourne. We have a national office in Melbourne with about 40 staff, but we are a national organisation. So our mission really is to support, inform, represent and connect Australians affected by breast cancer. And we go across all states and territories of Australia with our range of information resources and with our information forums that we hold for women.
Okay, so the beneficiaries of your service then are the women with breast cancer and their families?
That's correct, yes. So we know that this year about 15,600 women will be diagnosed with breast cancer, but also men are affected by breast cancer, and about 145 men will be diagnosed in Australia this year. So we support those people and we also support their family members and carers.
Now Cathy, just let me check that number. That was extraordinary. Was that 15,000 a year?
Yes, that's right. More than 15,000 every year. And the incidence is actually increasing. So, although mortality fortunately is decreasing, incidence is increasing, and that's partly because of the ageing population. You know, breast cancer is really a disease of ageing, and as the Australian population gets older, more women are being diagnosed.
That's an extraordinary number. Tell me, when you mentioned men suffering from breast cancer before, that's kind of not something I would think would be commonly known outside of the profession. Is that the same kind of cancer?
It is. It's exactly the same sort of cancer. So they have the same sort of pathology and they receive the same sort of treatment that women receive. But you're right, it's not widely known, particularly amongst the general public, that men can get breast cancer. So there are some specific issues for men when they're diagnosed, and a lot of that is around that stigma. And men tell us they feel embarrassed to be diagnosed with what is, seen to be a woman's disease.
I can understand men being embarrassed with the perception of it being a woman's disease, but I guess in terms of mortality and disease outcomes, it's pretty much the same.
It is stage to stage at diagnosis, the outcomes are the same. I think the issue with men is that sometimes, because they're obviously not involved in the screening program, they're diagnosed a bit later. So if they're diagnosed at a late stage and the cancer, the tumour is already large or has started to spread, that gives them a poorer prognosis.
I see, and I can understand. It just, one of those things never occurred to me. I can understand that it's not caught in screening, and I guess it's just a GP diagnosis really from maybe lumps in the breast and that sort of thing, is it?
Well, that's right. It's from having a symptom. So yes, a lump in the breast or a discharge from the nipple, something that's different and unusual. And so we do, recommend to men, as we do to women, that if there's any change in their breast, that they should see their GP and have it checked out.
Good advice. For those of you who have just joined us, my name is Wayne Buckler and you're listening to Health Professional Radio. I'm in conversation with Cathy Wells, who's the Policy Manager with the Breast Cancer Network of Australia, and I've just led her down a track well away from policy and what we were going to talk about. So let's see if I can get back on track with you, Cathy. Why is it relevant? Why is the Breast Cancer Network relevant to health professionals? What's the message we're trying to get across to them?
So I think the message is that the Breast Cancer Network's been around for 16 years now. We were established in 1998. We're a very credible and reliable source of information for women affected by breast cancer and the men we've just been talking about. So we have a range of information resources, all provided free of charge to people who are diagnosed with breast cancer. So we can help health professionals with the provision of information to women. So they're things like our My Journey Kit, which is a comprehensive information pack for women newly diagnosed with early breast cancer. We have Hope and Hurdles, an information pack for women diagnosed with secondary or metastatic breast cancer. And then we have other resources as well. We have a My Care kit with the generous sponsorship of Burley. Burley have provided us with more than 100,000 post-mastectomy bras over a number of years, and we send those out to women who've had mastectomies and breast cancer surgery to help support them after their surgery. So we also have a range of booklets and fact sheets on all sorts of topics. We've got a fantastic booklet on hormone therapy. A lot of women tell us that they have trouble continuing with their 5 years of hormone therapy treatment because of side effects. So we've developed a booklet to stress to them the importance of continuing the full course of their medication and giving them some practical strategies for managing some of those side effects. We've got other booklets on breast cancer-induced menopause, on exercise and healthy eating. There's lots of evidence now that exercise and healthy eating can help reduce the risk of breast cancer occurring, as well as helping to reduce the risk of other diseases such as diabetes and heart disease. And then we've got a range of fact sheets that cover side effects such as of treatment such as bone health and hair loss, and practical issues like travel insurance, the patient-assisted transport schemes that the state governments run, and financial and practical assistance that's available for people. So our information is also available to health professionals. We're very happy for them to call us or to get online and order our resources so they've got copies for themselves. And we'd love them to recommend them to the women that they're seeing to their patients. We have close working relationships with clinicians, both on an individual basis but through also the peak organisations, so bodies such as the Medical Oncology Group of Australia and the Breast Surgeons of Australia and New Zealand. We work closely with them. And we have a strategic advisory group here at BCNA, which is 14 leading breast cancer clinicians from around Australia who have generously donated their time and expertise to assist us and provide us with advice on clinical matters. So all our resources are developed with input from health professionals. We want to make sure that they're clinically correct, but they're also developed with input from women affected by breast cancer, because we want to make sure we're giving the women the information that they need and in a format that's accessible to them.
Cathy, it sounds like an ideal service. Health professionals can access your information on the website at www.bcna.org.au.
That's right.
Is there any issue with them referring patients directly to that website? Is that the best way for them to get patients in touch with you?
That is the best way, and we'd love them to do that. We also have a program, the My Care Kit program, which is the distribution of those Burley bras. So we link in particularly with breast care nurses who can register to be part of our My Care Kit program, and they then order the My Care Kit for women. But we'd certainly love health professionals to tell women about our resources, and particularly our My Journey Kit for women newly diagnosed. There's lots of information in there about treatments and treatment options, and as I said, it's written with input from health professionals, but also from the women. So there's lots of women's stories, quotes from women, tips and advice on how they've managed various aspects of their treatment and their diagnosis, or the difficulty in coming to terms with a cancer diagnosis, and how do you talk to your children about it, all those sorts of issues.
You're with Health Professional Radio, and I've been having a fascinating chat with Cathy Wells from the Breast Cancer Network of Australia. Now, Cathy, you're the policy manager there. What are the big events coming up? What are the current issues that are happening for you in your role?
So in our advocacy role, the issue that's really of most concern to us at the moment is the financial cost of breast cancer, and we're starting a big piece of work looking at that. We hear a lot from women about the cost of their treatment and of other services, particularly for women with advanced disease, with secondary breast cancer, who can be living for a number of years with their disease and paying for treatments. So we do a lot of work on having new high-cost drugs listed on the PBS. So there've been a couple recently for women with secondary breast cancer called Kadcyla and Perjeta, and they're new expensive targeted drugs for women with a particular type of breast cancer called HER2-positive breast cancer. We've been working closely with the Medical Oncology Group, with the PBAC, and also with the pharmaceutical company to ensure those drugs are listed and made available through the PBS for women. And they have now received a positive recommendation from the PBAC. We're waiting now for Cabinet approval because they're expensive drugs. The Cabinet needs to approve the addition of them to the PBS. So we're waiting on that, and we're talking to the Minister about that and letting her know that these are important drugs to be listed. So we've done that over the years with a number of drugs. We were very involved in 2001 with the Herceptin campaign to get this fantastic new breast cancer drug, Herceptin, subsidised for women. Now the other issue that we're particularly interested in the moment is the issue of out-of-pocket costs for breast MRIs. So a lot of women are being recommended an MRI prior to their surgery or in other specific circumstances, and at the moment there's no Medicare rebate for those scans, and women are paying up to $900 for them, so we'd like to see a Medicare rebate there.
I'm not sure that congratulations is the right word to say, but your work in getting drugs subsidised and available is certainly incredibly valuable, and well done to you for that. The cost of all disease is a problem, but with breast cancer, which is so invasive and such an issue, getting the cost into a manageable process also is worthy of congratulations. Kathy, tell me, what's the biggest misconception amongst your clients, clinicians, users, the public? What's the biggest misconception around what you do that drives you nuts and keeps you awake at night?
Look, I think the biggest misconception really for women when they're diagnosed is often they don't know another woman who's been diagnosed, and they feel isolated and alone. And we want to let them know that they're not alone, that BCNA is here to support them through our information and our services. And we want health professionals to know that if they're referring their patients to us, that those women are going to get good information and support. So what I haven't told you about, apart from our information resources, are our information forums. When we travel around the country speaking to women at these forums, we have 13 or 14 of them every year in major cities, but also in regional centres. So we're in Mount Gambier on the 9th of April in South Australia, and in Shepparton on the 14th of May, two of our regional forums coming up. And we bring with us a medical oncologist to speak about the latest breast cancer treatments, and also to give women advice on managing some of those side effects. And we bring a psychosocial specialist to talk about the emotional well-being and looking after yourself after a diagnosis of breast cancer. So we've been running these forums for a number of years now. They're very well received by women. We also encourage partners to come along to these days as well. So it's a great time for them to get information, but also to be able to network with others from their local community and meet some other people in their area with breast cancer.
Let me just mention, because we archive these interviews, that those dates were in 2015. So if you're listening to this on the archive at some later date than 2015, those dates are past. But if you go to www.bcna.org.au, there's further information about ongoing forums available on their website. Kathy, it's been a pleasure to talk with you this morning. We'll put a transcript of this interview on the website. We'll also have it, as I just mentioned, in our sound archive on an ongoing basis. People who do want more information, please feel free to contact Kathy or her colleagues via the web, www.bcna.org.au. You've been listening to Health Professional Radio. My name is Wayne Buckler.